The need for blood is constant. However, with the summer months upon us and surgeries starting back up, there continues to be an urgent need. Blood donations will now be sent to a laboratory to test for antibodies of the novel coronavirus.
So starting this week, anyone who comes to donate at any one of our donation centers here with the American Red Cross, their blood will be tested for the Corona-19 antigen, meaning it will tell them within about 10 days of donating whether they test positive or negative for the antibodies, meaning if they have been exposed to coronavirus.
The Food and Drug Administration has approved the plasma to be used from those who have been exposed to coronavirus to help further the cause in fighting the virus. The plasma with antigens will be made into a blood serum to actually treat people with severe cases of COVID-19 in the future.
When you do the testing and you test positive for the antigen, that doesn't necessarily mean you're immune to coronavirus. You still want to practice all the social distancing and all of the regulations as put forth through your state and the CDC. What it does is it provides an opportunity for people who do test positive for the antigen to hopefully come back and donate plasma to our plasma centers to give that convalescent plasma, which will be used to help those that do have the coronavirus and that are pretty sick.
Donors will be notified within 7 to 10 days of giving blood if they have the antibodies.
You'll be notified through the donor app. So you download our Red Cross app and it'll tell you after your donation about 10 days whether you're positive or negative for the antigen.
However, the COVID antibody test is not a diagnostic test for the virus. It's only for donations and taken from healthy people who want to donate blood.
We only accept people who are healthy, that don't have a temperature, that don't have any symptoms. And the COVID test is simply to find out whether you are positive or negative for the antigen, meaning if you're exposed to coronavirus in the past sometimes. So yeah, we are only accepting healthy donors.
Coronavirus is not transfusible through blood, so donating blood is safe. And blood donated in St. George goes to Salt Lake for processing and typically comes back to our community.
In fact, I donated several months ago. I did a double red where you give 2 units of blood. One of those units made it clear out to Maine, and the other unit went up to Salt Lake and then made it back here to Dixie Regional. And so it came right back home here to St. George. So when you do donate here in St. George, you are helping the people here in your own backyard.
The American Red Cross supplies about 40% of the nation's blood supplies. The Red Cross is the only blood bank offering the COVID antibody testing at this time in southern Utah. Many believe the results may give people peace of mind knowing if they've had it or not. While there is no real science to prove who may be susceptible to the virus, there has been a lower incident among a certain blood type.
There have been some reports of O types being less susceptible. I don't know by what percentage. But as far as safety precautions, we do advise everybody, regardless of your blood type, to take those into consideration when you go out in the public. When you donate, all donors are required to wear a mask. And yeah, just be safe out there.
Donor appointments can be made through redcrossblood.org. He said they are grateful for those who give regularly.
We're grateful for them, and we're grateful for our new donors that hopefully will come out, maybe even for the first time. Find out if you have the antigen or not. Donate some blood and help save a life.
In St. George, Melissa Anderson, Community Education News.